now Dr. Robert Kim-Farley. He's an epidemiology professor at the UCLA School of Public Health. Good to have you, Doctor. I wanted to actually start with this new case in the US, California. Apparently someone with no known connection to a carrier. I'm curious what you make of that in terms of community spread. That person presumably had many contacts, and what does that mean going forward?
Thank you, Michael, for the question. Basically, the CDC is very closely, together with state and local officials, looking at that particular case to be able to really investigate as to whether there was any potential contact with someone who had traveled to an affected area. But if there is no such situation, then it is a potential of a first example of a community transmission. That's basically when you don't have knowledge of where did the source come from.
Right, and that's what's worrying about it. The other thing worrying about it was the person wasn't tested for several days. That's another issue to talk about. I wanted to ask you about mortality rates, and without sort of, wanting to sort of make people fearful, the reality is that the common flu, the mortality rate is 0.1%. That kills tens of thousands of people in the US alone. The coronavirus death rate around 2.3%. That could potentially mean tens of thousands of deaths. Again, without being alarmist, what are the risks of that scenario in terms of the math?
I think a few things to recognize. Firstly, that 2.3% overall mortality rate includes, obviously, Hubei province. Even if you look within China, Hubei province has a much higher case fatality rate, we call it. In other words, people die that had been cases, than the rest of China. I have a sense that one of the reasons the high mortality rate occurred there was because their healthcare systems got overwhelmed with lots of people coming with severe illness, and they had to build new hospitals, et cetera. Whereas other places within China had more time to react to this, has not overwhelmed their healthcare systems, and again, the mortality rates are much lower. So. Right. I think also there's something to realize that there's a number, the denominator of what you use against deaths is the issue of how many people have, are cases. But if you have a very mild case, and actually 80% of the cases are mild, there's many that would maybe almost be asymptomatic. And so therefore that denominator may be actually much larger, which means that when you divide it into the number of deaths, the actual case fatality rate is probably lower. And even more, there's another number we use, you don't hear it much, but an infectivity to mortality rate. In other words, there are some people that may in fact have no symptoms whatsoever, but still are being infected. And if you looked at that base as your denominator, the mortality rate would be even lower.
Yeah, and that's reassuring in many ways. Those who are asymptomatic, that's true. That sort of dilutes that mortality rate number. I mean, correct. Here in the US, though, the US president yesterday was heavier on rosy outlooks than he was on fact. And let's have a listen very quickly, and I'll ask you a question on the other side.
Because of all we've done, the risk to the American people remains very low. The vaccine is coming along well, and we have a total of 15 cases, many of which, almost much within a day, I will tell you, most of whom are fully recovered.
I mean, reality there is the president's undermining the predictions of his own top health officials who were literally standing behind him, saying that the risk to the American people remains very low, everyone's getting better. I mean, what are the risks of that sort of assessment, given the facts?
I think a couple of things. In terms of one aspect of the facts is that currently the risk in the United States is very low. As you point out, there's only maybe one area that might have some local transmission. However, I think what CDC is really trying to put out, and rightly so, is that we need to be preparing for the worst. We still hope for the best, obviously, but the reality is that we need to make sure that we understand that there is the potential and maybe inevitable potential, especially as we see more and more cases occurring in other countries, for importations to occur and more of these potentials for local transmission in the future.
Good. Yeah, good point. I mean, it is worth remembering that the Trump and White House cut the team in the White House that would deal with pandemics and cut funding to the CDC and proposes more cuts to the CDC in the current budget. Those chickens could be coming home to roost. Wish we had more time. Dr. Robert Kim-Farley, thank you so much. Good to have your wisdom on this.
It's my pleasure.